Hello, everybody, and welcome to the Real Life, Real Kitchen podcast, a podcast for the curious mums. And we look at the themes of family, food, and community. Today, I've been very fortunate to have Dr. Ben Smith, physiotherapist, as we call them here in the UK, or physical therapist, as they are on the other side of the pond. Now, the reason I've got Ben on is he's not just a bog standard physiotherapist, but his speciality is in pediatric physiotherapy. So I have questions, obviously. This is why these interesting people come on my podcast. But I'd like, Dr. Ben, could you please give us a little bit of a background how you got into not just the physiotherapy, but why specializing in pediatrics?
Yeah, absolutely. So it's a really kind of a backward story. I had zero interest in going into pediatrics when I was in PT school. There's just not many 20 to 22-year-old guys who are like, it sounds good. Bunch of crying kids.
Yep.
That just sounds amazing. My life needs more of that. You just don't think that. So I thought, sports, patient ortho, something along those lines. And I went into that and it was fun. It was fine. Went through all of the pediatric classes in PT school, went through the rotations, you get trained in kind of everything a little bit, and then you specialize when you get out, which is what I did. But about 3 years into it, there was this thing that happened,
Mm-hmm.
and that thing was my wife got pregnant.
Ah.
Well, I had one of these little babies at the house, and I was doing some fun stuff with Noah is our oldest child. He's 15 now. But at that time, I was doing things with Noah, and man, the amount of time it took him to take the information I was giving him and learn it, and then do the thing I was getting him to do, I was like, oh wow, this is easier than adults, not harder, in some ways. So I just really kind of fell in love with that. And as he got older, 6 months, a year, 18 months, I thought, man, this is kind of fun, now. So I got into that and started a pediatric practice very slowly. Was fortunate to find some people that let me do it by the patient. I got to pay my rent by the patient.
Amazing.
I started my practice with $500.
Yes.
And I had my first piece of equipment was a giant Rubbermaid kettle trough, which is
Wow.
basically like a giant swimming pool
Yeah.
that I spray painted with really bright colors and put foam trim around and went and bought some balls, and I had a ball pit and frisbees and that kind
Amazing.
of stuff. But that's all kids want, right?
Yeah.
They want the fun. They don't care how much it costs.
Yeah.
So that's how I got into pediatrics in the first place.
Yeah.
And
So
it was, not how I planned it, but
it's funny how life takes you on these paths, and it is amazing actually the conversations I have with medical practitioners, how having children actually has a huge impact on their trajectory. So they think they're going in one direction, and all of a sudden, seem to be being taken off in this other route, which is proving much more interesting. Now, just a question in terms of the little ones learning the techniques, the exercises that you're giving them, or at least their body's learning that. Is that because as grown-ups, we're quite disconnected from our bodies?
yeah, that's part of it. And we have conflicting inputs, right? A 6-month-old doesn't know full sentences. They don't know languages. They don't know things like that. So the only language they know is touch, feel, light, sound. So it's the input that you give them. They're not processing the language and going, well, I think they meant this.
Mm-hmm.
They're just going, what do I feel?
Yeah.
Okay, I felt that. That's it. It's novel. Everything's novel to them.
Yeah. Yeah.
It's different.
So I'm going to take it back a couple of steps because I am sort of looking into this whole world. There's physiotherapy, there's osteopathy, there's being a chiropractor, cranial chiropractic, cranial. What is the difference between all these things?
Yeah.
You all seem to be prodding and poking and making a
Yeah.
difference, but what's,
Absolutely.
yeah.
Yeah, absolutely. So the main difference is PTs a physiotherapist or physical therapist are going to focus more on the functional movement of the body. Like how does your brain process and move in a normal way? And that involves most of your bodily systems, whether it's, vestibular, your inner ear, balance, visual, all of those things have to work together. Obviously, muscular, skeletal, ligamentous, tendons, all that kind of stuff, nerves. It's all integrated. Whereas more like an osteopath, chiropractor, the people that do the cranial work, Their goal is more, can your body move that direction? So, like, will your spine move that far?
Okay.
Whereas the physical therapist is like, can you move your spine that far and in an appropriate way? So they're complementary. A lot of people, and honestly, just to be real, a lot of chiropractors and a lot of physiotherapists, physical therapists are like, oh, we're competitors. We're don't go to them, come to me. When really they should work in tandem. It would be better for the patient. And I have some chiropractors that are really close here in geographically and in relationship. So we work pretty well together. It's
Okay.
best for the patient.
Yeah. Yeah. Because it should be about the health of the patient. They should be the central bit rather than the egos.
In theory.
In theory. In theory.
Yeah,
So
yeah.
you are a doctor. Is that as a result of getting your degree in physiotherapy, or did you do a PhD? You've got this title. It's very impressive. How did that come about?
Yeah. Yeah, and if you're on my Zooms, usually my screen says "Just Ben" instead of
Just then.
Dr. Ben. Just Ben. Yeah. Yeah, it's a clinical doctorate in the States now, so you can't graduate from PT school without your doctorate.
Okay.
It's required.
Okay. And then
So
that.
it's based on clinical time, rotations, like real live world experience.
Yeah. Yeah.
So
So
we don't do like a dissertation, like a PhD or anything like that.
okay. Okay. So that's where that comes from. So when you started off with the children with your giant cattle trough full of balls and the children romping and playing, what sort of things were the children coming, or obviously the parents are bringing the kids, but what are they coming to you with? What were the struggles?
So I'll tell you, the crazy thing about pediatrics is the variety of things that you get. You can get anything from ankle sprains, broken wrists, elbows, forearms, hands, so all the typical orthopedic things. But you can get all of the genetic things too,
Mm,
all of the chromosome deletions, the birth trauma, cerebral palsy, Down syndrome, autism, um, and then just kids that honestly, something that's not exactly right, but there's no diagnosis. The doctor just goes, I don't know, but they need to work on PT or OT or speech, so we're sending them. So it's really a mixed bag, of kids. So it's a very broad range of both verbal and nonverbal. So you may have a kid that's 9 years old, never said a word. Well, how do you do that?
yeah.
How do you get them to participate? How do you understand if they're in trouble or panicking or if they're in pain or if they're, how do you look for that?
How do you look for that? I'm going to presume the mother, or I'm going to say predominantly the mother is there as an advocate, but you as the PT, how are you kind of, because we're now using a different language, it is very much touch.
Mhm.
And it's not like, I mean, with a baby, you've got them as a mum, you've got them close to you and you physically know what's going on. But when you're meeting an older child for the first time and you've never met them before and you're having to be intimate like that, how do you read that? How do you communicate?
So as far as, personality or as far as just getting to know the kid, it's going to be a lot of interview with the mom
Hmm.
at first with the caregivers. If you're looking at the pain specifically, we use this with most patients, even adults, because adults don't really even understand their own pain sometimes. I
Mm,
would say a lot of times. We just assume because we're older and have more shiny things that we know more, or that we're more aware of our bodies than kids are, but many, many times we're not. So we use something called the FLAC scale, FLACC, and it's a nonverbal pain scale. And the F stands for face. So you look at their face, they get a score 0 through 2. So like 0 is just, they're just like normal face expression, whatever. 2 is like, they're kind of, they're kind of like looking around and maybe a little, eyes aren't staying still. Then a 2 is like, they're like clenched jaw, sweating, red, that. And you see that same thing for face, legs, how active they are. The A is activity. So like, are they fidgety? Are their legs just like squirmy and tense and they're rolling side to side, or are they just completely still and calm? The first C is cry. Like, look at their eyes. Are they watery? Are they perfectly fine? Are the tears just pouring out? And then the last one is consolability. Like, if you just go, so maybe they're a 0 on all the other ones, but or they look like it, but you can go up and pat them on the back and say, "Hey, how's it going?" And then they just light up. Well, they just wanted to say hi. They just wanted you to come over and give them a hug, and they were
yeah.
mad you hadn't said hi yet. They're not hurting. So you kind of go through all 5 of those, and it gives you a score from 0 to 10. because a kid can't tell you like, "Well, what's your pain today on a scale from 0 to 10?"
But, I think there
"Oh,
are a
no,
lot of
purple."
well,
Yeah. So
but
that's kind of a nonverbal way to do it.
that's a really helpful framework to have actually, because I mean, even as everybody, my sense is that different people have different pain thresholds. There are some people who
Really?
seem to just be able to kind of push on. There are others where it's like, oh, you've got a paper cut and your world's falling apart. They got these different things. And also, I suppose there's a difference between acute pain, all of a sudden, bam, that's come out of nowhere, and the gradual pain. You don't realize you're carrying that and how weary you are until it stops. Yeah, no, this is quite a useful thing, certainly for the little ones. But I presume you see that as well with the children. There are these different um, levels of pain tolerance within different individuals.
Yeah, absolutely. So that's called interoceptive.
Mhm.
You want a fancy word?
I'm writing it all
Intero
down. Interior.
Yeah, interoceptive.
Yeah.
And what that means is that some people just have a greater sense of what's going on with their body. They get stronger signals. I mean, it's, just like some people have better hearing and they just, they're more sensitive to whatever it may be. Even with internal organs, some people are just more sensitive to the sensation of their internal organs and things like that. You don't know that with a kid.
No.
They don't have any idea. The thing with kids, when they say that they hurt, everything's new and they don't have the vocabulary to tell you, this is weirding me out. Like my stomach is bubbling. I've never felt this before. I I don't know. It hurts. That's the only word I've got. It hurts. So it's just whatever the feeling is, because kids get so many new novel sensations all the time. We think about when you've had a stomach ache. Well, you've probably had 20 different types of stomach aches. You've had some that are kind of crampy, sharp pain. You've had some that are just annoying, dull pain. You've had some that are kind of bubbly feeling. You've had, whatever. There's a whole variety of them. Well, that kid may not have had that experience till they're 9 years old. They may have been on the earth for 9 years. Now they're going, what is happening to me? I'm falling apart. This
I
is
love
it.
that. I love that.
This is the end. So they just go, my stomach hurts. My stomach hurts. My stomach hurts. Nobody move. My stomach hurts. you know? So, because they don't know, they're not going to say, my stomach feels a little bit gaseous and I think I need a little more fiber in my diet, mother. They're not going to say that. They don't know. So it's not going to happen. And then I think probably to go back a couple of steps further, I think it would be useful. I think it would be really good to understand, to start off with, what is pain?
Yeah.
What even is it? You
Mm.
know? So pain is not like, I have a coffee cup. Okay. I can't hand you a coffee cup full of pain. There's not a thing, right? It's not like something, you don't have, we used to think you had pain receptors, like there was a pain receptor in my finger, and when I hurt it, it would hurt and it would send the hurt to my brain.
Yeah. I
But that's
remember.
not what actually,
Yeah, I remember
yeah,
something like that in biology, and there'd be these kind of blobby things. There'd be synapses and things happening between. Um, but that is old science. So the new
that is.
science is,
So pain is actually a decision that your brain makes.
oh,
So it takes all of the information. So like in my hand, I would have all of these different sensors. Okay. So I've got hot, cold, like thermoreceptors tell me something's hot, tell me something's cold. Then I've got mechanoreceptors that tell me like if there's something stingy, did something stab me? Did it pierce my skin and go underneath it? I've got proprioceptors that tell me how far my joints are going. Like, is it going outside of somewhere that it's supposed to be? And it gives my brain all of this information. And my brain goes, hmm, is this dangerous or not dangerous?
yeah, you're
I think it's dangerous.
you're pulling your
Pain.
finger back too
Yeah.
far. It's going too far.
Yeah,
It's going to crack. Yeah.
exactly. It's a protective mechanism. So here's a helpful story that you can tell kids. Okay. You can tell kids, there's this little guy that lives in your head. Okay. And he was born the same time that you were. Okay. And it's like this little security guard that lives in your head. And he is watching everything that happens to you. Okay. Everything you feel, everything you see, everything you touch, he's in there and he's looking out for you. Okay. And his only job is to go, that's dangerous. That's going to hurt Noah, whatever your kid's name is. Okay. That's dangerous. That's going to hurt Avery. I'm going to protect Avery. So I'm going to take this switch and I'm going to go pain so that Avery will know, Avery, this is dangerous. Stop. You need to stop what you're doing because this might hurt you, right? This might cause permanent damage if we keep going down this road. So his only job is to go, alarm on, So when you sprain your ankle and your ankle goes way outside, what does your security guard do? Zoe, what does your security guard do? He goes, "Oh,
Stop.
alarm," right? When you fall and you scrape your knee on the concrete, what does your security guard do? Alarm, right? And then you give them 3 or 4 of those, and you say, when I make you a bowl of ice cream and you put it in your lap, your security guard goes, and they go, oh, wait, I like that. And I go, see, you're learning and you're teaching your security guard. That's how he learns. He learns as you learn. Yeah. So that's how you can, a simple, easy, fun story that you can get. And it helps them externalize the feeling. So it's not just all bottled up, inside of them.
Yeah. Yeah.
But they can understand what pain is, why
Yeah.
it's even there, why we have it.
Gosh, it's interesting. Do you know, I heard something as well recently. Okay, actually 2 points. I'm going to come back to that point. I was talking to my son about leprosy, as one does, because we're looking at Bible stories, and obviously there's a lot of leprosy throughout, a lot of leprosy. But it was quite interesting because I was talking to him about the fact that this bacterial infection, the problem is it stops these senses, the ones, the sharp, stingy ones. You can't, so you will pick up a pan and it's hot, but you don't realize it. And then you get the injuries and then you get the infection. And that's why you get the kind of the lumpiness and all the everything going wrong, because you have these infections that you can't feel and it all goes wrong. And it was quite an interesting exercise talking to him. Imagine not having pain. This is the result. If you can't feel it, if you can't go, that is a hot pan, or I've cut myself, or ouch, that's been pulled too far backwards, that's a real problem.
Very much.
Yeah. Very much so. And then there was a second thing I heard recently, which I found fascinating. So I'm calling in from England, so we're going to talk about class. We're going to talk about class here. But a really interesting thing, how you had this observation that middle class versus working class women will also let me put this correctly. So they were talking about birth and sort of the struggles that some women have with birth. And you would get the middle class women were much more likely to say, I need the epidural, I need this, I need that, it's hurting too much. Whereas the working class ladies, there was more of a kind of a stoic, we're just cracking on, which I thought was quite interesting, sort of cultural perceptions of pain. This isn't specifically to do with children, but have you got any thoughts on that?
Yeah. So all a culture is a group of people who adhere to, rules without them being laws, basically, right? They just all kind of agree that this is how we behave. That's why you get some kids that behave a lot like their parents as far as pain goes.
Yeah.
So one of the first things that we always have, and typically, not to be harsh, but typically it's the mom.
Yeah.
Typically it's the mom.
It's fine. Say it. Just say it.
Yeah. Typically it's the mom. They're going to respond they can't respond any calmer than you do. So whatever your baseline of calm is to when they get hurt, they're not going to be calmer than that, right? You're kind of their anchor, you're their reference point, because again, novelty, like you're experiencing things they've never experienced before. That's why you've seen kids, you've probably experienced this. A kid will fall, hurt, hit themselves, run into a wall, whatever, and the first thing they do is they go, and they look at their parents like,
what am I supposed to do?
What's happening? Should I be crying right now? And then, if the parents give a pretty calm response, again, as long as it's not a major injury, the parents give a pretty calm response, they'll cry a little bit, but they'll, pretty much self-soothe. Whereas, mom or dad comes sprinting across the infield, to help little Susie who got barely hit by a baseball. Well, you've just taught her that this is an immensely dangerous event. So the little security guard in little Susie's head just learned, oh, when I get barely hit on the knee by something hard, this is like potentially life-threatening.
Wow.
I should probably completely freak out next time because that's what happened this time.
Yeah. Yeah.
Yeah,
Yeah. So
yeah.
so there is a cultural, a family.
Culture component to it.
Yeah, as well. No, really, really interesting. No, it's so funny. I had one of my youngest, he was those moments where the child is sitting, and then the next minute you're, where has the child gone? The child had done a flip into a washing basket that was empty on the floor, and everybody in the room went, but we had a quick look, and you're like, "Oh, no, you're fine. You're fine. It's absolutely fine. Let's put you back on the chair. You're fine." And he was.
Yeah.
So yes, it is sometimes having to kind of keep it together in those moments until you are feeling a little bit calmer as well. Um, with the physiotherapy, there's something I'm quite interested in again, I've gone down a little bit on this rabbit hole, and I've come across osteopaths who are helping the babies who've got colic, who've got tongue tie and things like this, and they're doing their clicky or whatever it is they do. And these babies, usually there's been a cesarean section, or there's actually been quite a traumatic natural birth. As a physiotherapist, are you dealing with those consequences later on with children? Are you able to help the babies who have that? Is that something that you're able to deal with?
Yeah, I wish that we would get them sooner. A big barrier to kids getting better and getting some of those things taken care of is actually this is always funny, is the parents, they either, they're gonna try to fix it on their own first, or we're blind to our own kids' flaws and shortcomings sometimes. And it's usually we're one extreme or the other. We're either like we look at our kids through rose-colored glasses.
Hmm.
It's like my kid would put it, but this is my kid is the best artist in the whole school, and like I mean, I could kick a can of paint over, and whatever, and it would be just as good as what this 10-year-old did, which is fine. But we just tend to look at our kids like that. Or we're on the opposite side and we look at our kid through whatever the opposite color of rose-colored glasses are, and nothing they do is wrong. And it comes from good intentions, both places, but really telling the true story in the middle of where your kid really is super hard as a parent, super hard. And that's why there's objective tests, right? That's why there's tests that are like standardized. We're testing you across your peer group, those kinds of things. So I wish that that would happen sooner. And I wish that it would become more normalized that parents had these skills that they could start working on. We call them developmental games. So we have 10 games that are developmental games that we give parents that are just fun time at the house. One of them is very specifically geared towards pain and anxiety in kids.
Yeah.
So we can talk about that at some point
Yeah.
today, whenever you want.
Yes, please.
Um,
Yeah.
and it's very, very simple, but it's very, very fun. It is my kid's favorite thing of the whole week. It's their favorite couple of days of the whole week when we play that game.
Go on. So can you give me examples of some of these developmental games? Dinner's burning, the washing's multiplying, and someone's crying. It could even be you. If your evenings feel like survival mode, the Command the Chaos Mum Life Management Planner is your first gentle step back to calm. It's a printable 80-page guide and planner to help you reset your routines and breathe again without needing to become someone else entirely. Start your reset today. The link's in the show notes.
Mhm. Yep. So we have one called, this is good for socialization for kids if you have like an older kid, younger kid,
Mm-hmm.
that seem to have difficulty maybe finding the balance of playing together. It's called Rock'em Sock'em.
Rock'em Sock'em.
And,
Yeah.
and both kids, you clear out the living room floor, push all the furniture back, everything out of the way. And both kids have long, loose pairs of dad's or mom's socks on their feet. Your only job is you can't fall over, and you have to get the sock off of your brother or sister's foot. And the first person to get both socks off wins. There's no hitting, there's no kicking,
Yeah.
but there's a lot of squirreling around and balance, and they're
Grappling.
leaned almost all the way over anyway. So if they fall over, it doesn't hurt. It's really, really, really easy, fun game. And you can tell older brothers just like, okay, we need to teach them how to be good at this game. So I need you to help me teach them. So you're going to win 2 out of 3, but let them win one time, make it a challenge, but let them win at least once, and they'll, talk all kinds of trash if they're like my kids to each other. That's what my anyway. So, but it's just fun things like that, and then you can play with them. We'll play with them. But that does a couple of things. One is it's just fun, right? So it's family time together, which is just at a premium anyway. And then two, you're working on a ton of those bodily systems all at one time. So that's balance, coordination, strategy, and planning. If they're thinking about all of those things, what are they probably not thinking about? Probably not thinking about, oh, that kind of burned a little bit when I drug my toe across the carpet, right? Because they've got all these competing inputs. There's only so much bandwidth that your brain can process at one time. So when you're really busy with something fun, you actually have a lower threshold of being able to turn that alarm on because you just can't get the sensations as much. So that's one example. My favorite and my kid's favorite game is called Smash Time.
Smash
And
time.
this is where Smash Time. And this is where we save the Amazon cardboard boxes.
Yep.
This is my favorite way to do it. And we have a broomstick that we've cut off about 2/3, and we stuck a pool noodle on the end of it. So it's got a little handle and it's got a pool noodle about 2/3 of the way up. And we just take it out in the yard, and the cardboard box lives out in the yard. And they get 5 minutes to just beat the living daylights out of this cardboard box.
Yeah.
Just smash the heck out of it. We've done rubber hammers in trees. I mean, we've done roll up pillows inside of paper towels and whatever, punch it, kick it, roll it, whatever. The reason that's so good for kids for paint that are a little bit on the what we would call like a whiny kid, if you have
Mm,
so whiny.
yeah.
The reason that's so good for them is it teaches them big physical movements and fun can go together. Because if the only time they're experiencing big physical movements is when they get moved, like a kid runs into them, they slip and fall and hit the floor. The only experience they have with big movements is it hurt. So they're going to avoid all big movements and things like that. So they need to be exposed to, oh, movement is good. It actually,
Mm,
this can be fun too. And it's too late in the moment when the kid's being whiny. So if the kid's whiny in the moment, that's not the time to address it. You just sit there with them. A kid falls and hits their knee, whatever. Just, as long as that you can tell there's not blood coming out everywhere and bone shot. Of course, if it's a minor injury, you go over and you sit beside them, you put your arm around them and go, man, that floor is hard.
mhm.
Not like, man, your knee looks terrible. That's you're gonna get a very different response like that. God, man, that floor is hard, isn't it? And you go like that, and you put your arm around him, and you go, I remember when I hit I think I cried a lot more than you did when I was a kid, when I hit my knee on the floor. And he said, but, just tell me when you're ready. You're safe. I try to say, you're safe. You're not alone, whatever, instead of you're not hurt. That's not that big of a deal, because all they're telling you is no, I experienced an event. And what you're saying is no, you didn't. And they're like, yes, I did. No, you didn't. Yes, I did. I see it. It's purple. So, so, um, so that's a way of validating it without making it a bigger deal than what
Yeah.
it is. And you
Yeah.
need to give them the room to talk through it. And if you've told them the security guard story, right, then you can talk through it with them and say, man, what do you think your security guard, learned through this? It learned the floor's hard.
Mm,
Should probably try not to fall on it,
mhm.
you know, but we did have to go to the hospital, you know, like a couple of minutes, then it feels better. So think about how much smarter your security guard is now.
Yeah.
Man, you were teaching that guy all things.
And I'm thinking as well with the whiny child, having something like the smash time, what you described as a child who is quite subject to everybody else and everything else. Whereas the smash 'em, they've got much more control, autonomy, free
Exactly.
will, all of that. And that's giving them much more
Exactly.
confidence about things. Um, I want to go back just quickly to birth, babies, the effect of birth on the movement.
Yeah.
Yes. Have you got anything you can say on that? Do you? I don't know. It just isn't really something that comes up. You find it in the crunchy circles, but in sort of mainstream, the profound effects that birth seems to have on some children. Have you got any
Oh, well, yeah.
observations on that?
Yeah. Think about what a change. You've been inside mom, it's warm, it's nice, all of the sounds are kind of, like, muffly and calm and, serene, and you're just kinda floating there, like, in your own sensory deprivation tank,
Mm.
and you can hear mom's heartbeat, and all of a sudden, you're just, like, rushed out into the world, right? And then during that process, sometimes you get, you know, um, cranial misalignments, you
Yeah.
get work traumas, you get, all of those sort of things. So from a movement-based standpoint, what we wanna do is make sure that those kids are going through every developmental milestone, all of them, not skipping one, not going, "Oh, well, look at my kid, he's walking at 6 months." But he never really crawled, like, a lot, and he
Mhm.
never was really, like, super tummy time baby, didn't roll both directions, because those are all avoidant
Oh,
behaviors in babies. That means that they're weaker on that side, they're not comfortable on that side, they don't trust that side.
yeah.
Maybe it's a little bit, like the cranial, misalignment part of it. Like if they always have their head kind of turned this way, you start seeing, torticollis, that kind of we get like, like shortening of a neck muscle, those sort of things, because that all affects, kids as we get older,
Mm.
and even into adulthood. So you really want to make sure that your kids go through every developmental phase,
Yeah.
like firmly.
Yeah.
And because as a parent, it's easy to go, well, look, my kid's already walking at 9 months. It's like,
Oh,
yeah, but
that's
that might not be
that sounds
ideal.
that's exhausting. You don't want them walking at 9 months, no. Um, a question, because I also within my range of children, we've had crawlers and we've had bum shufflers, and the bum shufflers have been pretty speedy, but they never crawled.
Yeah,
Is that
yeah,
because they were avoiding something?
just faster.
Just faster.
If they feel like they can do, especially if your kids are pretty interactive, like
Mm.
if they have a high natural level of curiosity, like I see thing across the room, I'm going to get thing across the room. And if they feel like they can do that, faster by whatever means, then they'll do it that way, and that's okay.
I also
You know,
I loved with the bum shuffling as well, it's they'd have a free hand for holding, so they could still move quickly and hold on to something, whereas when you're crawling, you can't. You can't.
yeah,
So,
yeah, that's exactly right.
okay. So a little bit of a takeaway from that is if a child has been avoiding things like the crawling, the rolling, and all of this sort of thing, worth just having a bit of a taking them to have them prodded and poked by physio.
Yes and no. So I'll give you what I would. This is what I would do. This is what I would tell a parent. Hey, our kid rolls and looks over to this side for whatever reason. Like they just don't. They just ignore the other hand. Really, they just don't use it much. It's just kind of, and it's usually something that you notice. Like this is something that's pretty obvious. The first thing you would do is just for the next week put everything on that side that they want. Like just make them. They may have just they're just not doing it because they just never have had to. So just give them the opportunity to do it first before you have anything like that done. But worst case scenario, 99 kids out of 100, probably more than that, are going to be just fine development. They're going to develop at their own speed. You just have to understand there's a range. When you look at these standardized tests, there's a reason why it says it's normal. Walking is normal from 9 months to 15, 16, 17 months. I mean, that's a wide range. That kid's almost twice as old
Mm,
chronologically as a 9-month-old, but it's still normal. So it's just having the perspective in place that makes the biggest difference. Then at that point, if you're like, nothing seems to work, I'm looking at these developmental milestones, we're a pretty good ways past it. Yeah, take them in, and just have somebody look them over.
yep, yep, and have a check. Okay. Can we come back to the whiny child? Because that made me then think about pain and anxiety, which you referred to
Mhm.
earlier. Can you sort of expand a bit on that? Because obviously, sort of anxiety seems to be a big thing, certainly amongst the teenagers and the what are they called before before they become
Mhm.
teenagers. Is there anything you can talk to on that?
Yep. So in younger kids, anxiety is typically like from a clinical standpoint. And again, if you're a psychologist or a psychiatrist, I'm a physical therapist. So you can explain this however you want to if you're listening to this. But the way that we understand it is that anxiety really results from two different things. It's a low level at its base. There's some kind of thing you're sensing. It's a low level threat. You're constantly in this state of like There's a low-level threat around me at all times. I just never feel like there's not a threat. Even if it's just tiny, right? Just very, very low level. In kids, that's usually like household environment. And it's not that you're treating your kids badly. It's not that they're, like siblings are mean or whatever. It's usually mirrored behavior from the parent. Like if you're always in a hurry, in a rush, always you just look like you're just stressed all the time, they're gonna look at mom and dad and go, man, they're bigger, stronger, older, wiser than I am, in their primitive brain, even if they're babies, and they're gonna go, they look like something's not safe around here. I guess I should feel that way too,
Yeah.
you know?
Yeah.
So they just constantly walk around at that low level state threat. So what that means is it doesn't take much. Like if they're a 4 out of 10 walking around every day, it doesn't take much to get them to a 6. And now they're like, oh, and they're starting to get whiny and verbalize and, everything hurts a little more than it would otherwise versus a kid that has virtually no anxiety. Something, pretty annoying may happen to them and they can kind of, you know, bounce it off because it only brings them up to a 4 versus if you're already at 4, now they're an 8.
Yeah. So it's
So
tipping them over when they're
yeah,
already at
yeah,
a low baseline. Okay.
that's right. So they're at that threshold already. And then in teenagers and in like the early teens, the tweens, teens, all that kind of stuff, even early adulthood, social media,
Oy.
ways, what's somebody going to say about me? What are they going to post? I'm in competition with them. Is this girl going to post? Is she going to look better in her prom dress than I am? Is this guy going to go out with this girl? Am I, whatever? Am I going to make the team? Am I going to be on varsity or junior varsity? Am I, there's all these things that they have and a lot of that we didn't have to deal with. Social media came about really right when I was getting out of college was
Yeah.
when it really got
Yeah.
big. It was there, but it wasn't like it is now. So for teens, it's that and directionlessness.
Mhm.
So if they feel like there's no compass, and this is for adults too.
Mm.
Anxiety is when you really feel like you don't know which way to go. So like if you've been working on a project and you start to feel anxiety about that project, it's probably because you don't know the next step clearly. So you get anxious about it. Well, that makes all of your other bodily systems more sensitive. So now, pain is worse, depression is worse, their attitude is a little worse, not to mention, the gigantic hormonal swings that kids
Oh,
go through
goodness,
at 12.
yes. And it's quite,
So,
I'm also thinking if you're one of these people who feels your body more, it's quite a sort of squishy. There's a lot sensory happening and changing when you're a teenager,
absolutely.
on top of just all of the kind of the mental stuff as well. Um, so you're having all of that, so you're much more sensitive to it. Question for you. I was listening to an interview with Jimmy Carr. I don't know if you come across him. He's a English comedian, but he travels a little.
Comedian, yeah.
Yeah, yeah, yeah. He's quite have to admit, not that keen on his comedy, very sweary. But if you hear him speak in a normal capacity, he's lots of wisdom there. Um, Obviously he's not a medical professional. But he made a really interesting observation. He was talking to, I think it was the Chris Williamson podcast, and he was talking about anxiety and depression. And Carr said, I prefer to use the terms worry and sadness. Now, I know there's clinical depression, but I thought that was quite a powerful change using that language because that's more of this is passing, I'm going to get through it. Whereas the anxiety sounds like much more of a label. You're an anxious person. You have this thing. Is that, again, sort of the language side of things is quite interesting for me. Is that something that you're dealing with, I presume, as well with the parents? Sort of tailoring your language to give encouragement and a bit more direction, self-empowerment. Have you got any thoughts on that?
Yeah, I think that's great. I really, really am avoidant of putting like a permanent label on someone. So, you know, it's no different. And this will sound absolutely ridiculous, but this is the same thing. If you just said, well, you're just a bad kid,
Mm,
like you're not going to tell your kid that, you shouldn't tell anybody else's kid that.
yeah.
You shouldn't, but you shouldn't. You say that was a bad decision.
Mm,
It's not a permanent situation versus if you have clinical depression, you have this, now it's like, oh, it's this thing and it's part of me forever for the rest of my life.
Mhm.
And there are people who have, a genetic predisposition. You can see it on MRIs, you can see it on that. But it's kinda like the people that say, "Well, I just can't lose weight because I have a slow metabolism."
Yes.
Like, do you know how many people really have a metabolic disorder? It's not many. It's like a quarter of a percent
Ooh,
of the population.
yeah.
The rest of us just like food more than we like activity. It's it's really not more complicated than that, you know? But we like to say, "Oh, we had this thing." And the other problem with that is if I am the problem, I can be the solution.
Mhm.
Right. If my genetics are the problem, well, you can't change your genetics. So now there is no solution. Or the only solution is medication. Or the only solution is whatever. So it's just very disempowering for the kid or the adult or whoever to go through looking at life like that.
It's interesting, that whole kind of genetic element. Again, not a scientist, not a medical professional, but, I have one of my interviewees, Liz Corcoran. I've interviewed her for about functional medicine, so anybody who's listening, you can go through the back catalogue. But she is also leads a charity, the Down Syndrome Research Fund, where they are looking. Obviously, that is a genetic condition. That is, you've got your chromosomal abnormalities, which means you get the Down syndrome. But there are particular elements, for example, the mouth breathing, the snoring. There's kind of sleep apnea and problems there. And what she's looking at, yes, this is a genetic thing, but let's see what kind of interventions we can do to alleviate it. And I think that's it seems to me at least, again, a much more kind of empowering, encouraging way of looking at things. Again, I'm a sort of healthy person, or my children are healthy. I don't have this, but my sense is, yes, there might be a genetic predisposition, but there are ways to alleviate and still strengthen. Is that fair? Or am I
Yeah,
demanding too
absolutely.
much of people?
All anybody can do is maximize the hands that you've been dealt. That's all you can do in anything that you have, any situation that you're in, genetics or regardless. So for you to go through, life without an attitude, like that, where if all we're going to do is we're going to look at, let's find something wrong with us and that's it. Well, let's just all go jump off a cliff right now because it's hopeless. Now, if I did all of your labs, if I x-rayed and MRI'd everything in your body, you know what I would find?
Mhm.
Something, something.
Yeah.
I mean, in every human alive on the planet, you're going to find some kind of abnormality. Abnormality. If you did an MRI of my back, I'm 41, be 42 in July. If you MRI my back and my spine, as much as I've played sports and Brazilian jiu-jitsu and whatever other stupid things I've done my whole life, you're going to find something. I have a disc that's compressed. I have it's going to be expanding. I have osteophytes, bone spurs. You'll find something, but that doesn't mean that it has to be symptomatic.
Mhm.
You can make it not symptomatic. You can have the abnormality and still not have to deal with the symptoms.
Mhm.
And that's what this lady is doing,
Yeah.
which is wonderful, I
Yeah.
think.
Yeah. Yeah. That's no. It's Yeah, no, that's a very powerful way of looking at it. You've got the hand you've been dealt. Onwards to greatness, onwards to glory.
Oh, and here's my other take on that. Okay. So I know you can't tell by looking on the camera right now, but I am a towering 5'7", okay,
Hooray!
with my Irish background. Okay. So I could look at that and I could say, well, I was just born short, whatever, or whatever other, I'm left-handed, which I am. Whatever other weird things about me you could find. But if you look at life like it's a hand of poker that you've been dealt, okay? Like what we like to do is go, oh man, look at that ace. Look at that. Yeah, but they have an ace and a bunch of other junk. Like
Yeah.
you've got three eights. You're an eight in creativity, you're an eight in wit, and you're an eight in writing, and you have an interest in political science. Great. Be a political cartoon columnist.
Yeah.
That person can never do that, that you're looking at right now. So it's more about look at the hand you've been dealt because it's not the highest card that wins, right? It's learning to stack them. How can you stack the things that you have on top of each other where it's just you, where it's just your thing and your calling. And your kids are going to be the same way. So help them. Don't push them into that. Help them figure out what that is.
Yeah. Yeah. To find
Be
that.
one of the
I have to admit, I'm quite envious of you're 5'7" because that means you can do things like forward rolls, and that was never my gift. It was just because I'm 6 foot, so it would be like a kind of a flop to the side and legs and arms and coordination. I was regaling my family with my attempts at tennis. Not my gift. So yes, but other gifts definitely have those. Ben, thank you. That's given again, I mean, I just love these conversations. It's such a blessing to have them, and people like yourself who come on and are willing to answer and hear my thoughts and curiosities. Now, you've very generously, I'm going to have it in the show notes, but you have created a bit of it's not a checklist, but it's kind of an explanation of how parents can identify pain and what is actually quite serious. We should really investigate this further, what's less serious, and also the story about the security guard. So that's all going to be in the show notes. So people feel free to download that and have a look at that, because that's going to be just fantastic. Thank you. Now, is there any other words of wisdom you could give to the mums who are listening? A kind of any tips that you wish you could give most mums when they walk in and you go, oh, I wish you knew that, and then things would be different? Is there one kind of tip that springs to mind?
Yeah. Be calm for the first just 5 or 10 seconds, because you're going to want to react in a certain way too. And that first 5 or 10 seconds is not just for the child so they can figure it out. It's also for yourself. Because as our emotions, like our uncontrolled primitive emotions, go up, our intelligence usually goes down.
Yup.
It's usually opposite directions. So not only will you be reflecting to your kid that most times they're going to be okay, this is just a learning experience. They'll learn to self-regulate, but you'll learn to self-regulate in that small moment right there too. You'll have a better go at it, and you'll be able to give your kid better advice because you're not going to be so amped up, yourself. And that goes for moms and dads, but we're talking to moms right now. So,
yeah. So we'll go with that. So no, that's brilliant. Do you know, it's funny. I've spoken to people who do sort of money mindset budgeting, and for them, their tips were also kind of mums. Think about your calmness, think about your language around money. And it's so interesting. Again, that applies to kind of pain, illness. Yeah. Yeah, it's very interesting. Okay. Things to think about. Ben, bless you. Thank
life,
you.
Life and death and the power of the tongue, Zoe.
Yeah. Oh, yeah. Very true. Very true. All right. Thank you, Ben. And I would like to say to all the listeners, thank you very much. If you find that this has, resonated, I believe is the technical term, please like, share and subscribe because every little helps to get the word out to all the curious mums out there. Thank you so much. Until next time. Love the podcast and want to help keep the kettle on? You can support the show. Think of it like buying me a cup of tea or helping cover the cost of the biscuits. You'll find the link in the show notes. Thank you for keeping this kitchen conversation going.